When you first stand up and stretch after sitting for a long time, you may hear a crack in your back. It feels good and make you want to do it again. And some people crack the spine repeatedly. But is cracking the spine harmful to the body? I will answer this in my new series called Second Opinion. Here we will learn together to understand our body so that we can take care of them properly. If you are new here, let me introduce myself. My name is Dr. Tony Setiobudi, an orthopedic and a spine surgeon at Mount Elizabeth Hospital, Singapore. Don't forget to subscribe and activate the notification button. I will share more medical information that is useful, up-to-date, trustworthy, and easy for you to understand. Have you ever wondered what actually happens when we crack the back? Cracking the back is also called spinal manipulation if it is done by professionals like chiropractor and physiotherapists. Most of the time, cracking the back is not painful. It feels good. The cracking noise is not caused by broken bone. Here I can assure you. Actually, no one knows for sure where this cracking sound is coming from. But there are two theories that explain the origin of the cracking sound in the back. Theory number one, synovial fluid and pressure. The spinal bones are connected to each other by facet joints. Cracking the back stretches squishy capsule of the facet joints. Stretching these capsules releases the joint pressure. The synovial fluid becomes gaseous and makes the cracking or popping sound. This quick change of state is called boiling or cavitation. Theory number two, other gases and pressure. Some experts believe that gases like nitrogen, carbon dioxide, and oxygen build up in the facet joint from time to time, especially when the joints are not properly aligned and swell from poor posture or after sitting for a long time. When we stretch, the joints move around and gas is released, making cracking or popping sounds. Why cracking the spine feels good? The abdominal pressure in the joint causes some discomfort. When this pressure is released, many people feel the back become light and comfortable. When the spine cracks, endorphins are also produced and released. This is a chemical similar to morphine that can reduce the pain. Your back pain may reduce significantly or even go away following cracking the back. Endorphin also makes us happy. It can be addictive. That is why people who often crack the back, they will do it again and again. It is addictive. What are the risks of spinal manipulation? Actually, the risks are very small, especially if it is done properly. But here are some of the risks. Number one, a pinched nerve. There are many nerves in the spine. Spinal manipulation can cause a slip disc that pinches the nerve. If you feel pain radiating to your leg or to your arm after spinal manipulation, you need to see your doctor immediately. Number two, cracking the back forcefully can also strain or tear the muscles in and around the spine. Strained muscles can be very painful. Movement becomes difficult. Fortunately, muscle strain can recover on its own. And number three, frequent spinal manipulation can cause spinal instability in the facet joints. This problem is called over-manipulation syndrome. This can cause painful back or painful neck. Number four, cracking your back too hard or too much can injure the blood vessel. It can be dangerous. If this occurs in the neck, it can cause a stroke. Number 5, spinal manipulation that is too hard can cause spinal fracture. It is very painful and sometimes surgery is needed to stabilize the broken bone. Elderly or those with osteoporosis should be careful with spinal manipulation. Spinal manipulations performed by ourselves are much safer than those performed by others. This is because we know the limit of the body, so it is much safer to do it ourselves. In conclusion, is cracking the spine harmful to the body? Most of the spine manipulation are harmless, painless, and actually makes us feel good. However, spinal manipulation must be done with the correct technique to reduce risk of spinal injury. I hope this second opinion series is useful to all of you. Thank you for watching, and don't forget to subscribe, like, comment, and share this video. And I hope to see you again in my next second opinion series. Bye bye.